Hello, I'm Dr. Omar Almallah. I want to talk a little bit about the ClearView. I have a primarily premium IOL practice. I do almost exclusively femto, and in the last 3 years, I've pretty much been providing patients with spectacle-independent vision. I've been able to do that with the introduction of the trifocal implant and had a lot of success with that. However, in the last year and a half, I was introduced to ClearView, and it's been a real game changer for my practice. It's done that because I'm able to give patients the vision they want, which is spectacle independence. However, they also have pretty much independence from dysphotopsia. You know, we had a lot of success with IOLs with the annular rings, especially with the trifocal, very good near, very good distance, and intermediate. But it was constantly an issue with some patients about the night driving. I've had patients, even though they can see wonderfully, they don't want to drive at night, and it's just disappointing. So when the ClearView came out, it was a big change. Now I can provide the same kind of vision, and I actually think it's a little better. They get extremely good near vision. Very common that your patient's going to have J1, and they're going to have very good distance vision, and I don't know how it works, but the intermediate vision is excellent. I've done patients with that work as dispatchers, and they tell me they have computer screens on the wall and they need to be able to see those. And it was with a little bit of trepidation when I did the first patient with those needs with the ClearView, and they say they can see it amazingly well and they don't need any glasses. So this is a real change from what we've had with our other lenses that can perform like this, but that have dysphotopsia. You're going to find, if you try this lens, you're going to be very surprised with how much the patients are going to rave about it. If you're a refractive surgeon, you know how you did enough LASIK and it seeded the community, and you had patients referring to you because they were so happy. I did not see that with my other premium lenses. They were always a little cautious because of the dysphotopsia. With the ClearView, it's different. It's kind of like what I experienced with the LASIK. You do enough of them, and the patients are going to seed the community, and they're going to come to you and insist on that lens. They'll even look it up online, bring in a brochure, and ask for the ClearView. I've been doing this for 32 years, and I've never seen that before. So I would advise you to try it, because every month or two you go by without trying it, you know, your patients are losing out on it. I do refractive surgery, and I do a lot of clear lensectomies. So the ClearView is now my lens, my go-to lens for those patients. You're going to find a lot of those patients have had LASIK previously, and now they're in their early 50s or late 40s, and they're going to be coming to you wanting to maintain their spectacle independence. So they're not used to having the halos and dysphotopsia. So the clear lens is a great option for them because you can restore their vision. I'm also using the ClearView in a lot of my patients who are purely presbyopic. They have good distance vision. They're only coming because they want their near vision restored. And I've been using it in those patients and I've had very good success. This lens does not currently come in a toric, but if you're doing femto, you can use the femto LRIs, and they're very effective. I feel very comfortable correcting up to 2 diopters of against the rule astigmatism. You can even correct more if you're doing with the rule, which is not as difficult. And I have videos online if you wanted to see how you can do that. But so even though it does not come in a toric version currently, you know, that covers a large segment of your patients that you can do it in up to 2 diopters of against the rule. And I've had excellent results with that.